Pregnant women and new mothers are facing a deadly mental health crisis across the United States, and it could be getting worse. Mental health conditions are the leading underlying cause of pregnancy-related deaths in the country, and they're driving an alarming rise in maternal mortality rates.
In 2019, 754 women died of maternal causes, according to the CDC, and that number climbed to 1,205 by 2021. That translates to an increase of nearly 60% just in those 2 years. Out of all those deaths, suicides and overdoses accounted for nearly a quarter. It's hard to gauge by just how much maternal mental health may be worsening in the country, given the limited data available. But researchers believe it's getting worse since the country's overall mental health has declined since the COVID-19 pandemic. Nearly 30% of American adults say they've been diagnosed with depression at some point in their lives, according to a 2023 Gallup poll, almost 10 percentage points higher than in 2015. It also looks like the rates of substance use, anxiety, and other serious mental health conditions like postpartum psychosis and suicidal ideation are rising among pregnant women and new moms. One 2020 study from the University of Michigan found that the number of pregnant women who thought about self-harming or attempted suicide increased in the decade before the start of the COVID-19 pandemic. Researchers looked at suicide rates among pregnant people with private health insurance between 2006 and 2017, and they found that the number of women who thought about committing suicide or self-harmed tripled during those years. Struggling with mental health during a pregnancy or after delivery is not uncommon. About 1 in 8 women will experience postpartum depression in the year after they give birth, according to the CDC, but roughly half of these women will go undiagnosed. In fact, an analysis from the Policy Center for Maternal Mental Health found that fewer than 20% of pregnant and postpartum women with Medicaid receive a mental health screening. But even when cases of depression are caught, many women do not receive care. A study published in 2015 found only 22% of perinatal women who screened positive for depression received treatment. While experts worry about the future state of maternal mental health, they hope increased attention to mental health issues among pregnant and postpartum people will lead to more action.